It's important to understand that heart disease in the youth has actually increased over the last 50 years. In India, heart disease has increased by 300% over the last 30 years in general.
What is the difference between a heart attack and a cardiac arrest?
A person starts having severe chest pain, congestion, sweating, ghabrat, and that is because the heart muscle is getting damaged and it's heart attack. The cardiac arrest is a situation where the heart stops suddenly. Us to see someone at the age of 24, 22 getting a heart attack.
That COVID vaccines have actually caused this increase in heart disease or heart attacks.
When we talk about less than 20 years, yes, a person can have a heart attack. Do heart attacks actually increase in women and during pregnancy? We must remember,
How do I know that my heart is doing okay?
is high blood pressure, diabetes, raised cholesterol, and that family history. But stress तो हर एक को होता है जिंदगी में, after all.
Hello and welcome to HealthWire Chat, brought to you by HealthWire. We bring to you this video podcast where we speak to global specialists on a subject that concerns your health. And this week we are delighted to be joined by Professor Dr. Ashok Seth, Chairman of the Fortis Escorts Heart Institute and a household name on everything on relating matters to the heart. Dr. Seth, welcome to HealthWire Chat.
Thank you, Karan. It's a pleasure to be on the Health Wire.
Thank you. And we wanted to have a discussion around heart attacks and the young Indian.
Correct.
The demographic dividend that India has is amongst its young and the youth.
I agree.
But unfortunately, we're also seeing or witnessing cases that one hears about of the young getting cardiac arrests and having mortality as a result. So we just wanted to discuss that subject with you and dig straight into the first and most important question. Can young people get heart attacks?
So you're absolutely right, Karan. Yes, we've seen a greater incidence of heart attacks and deaths from heart disease more recently in the young. And of course, those sad visuals are in genuinely an increase in heart attacks, but also in a way captured by the social media and in a way bringing more awareness about heart attacks in the young. It's important to understand that heart disease in the youth has actually increased over the last 15 years. And there's been a 300% increase in that. And what we're talking about is that earlier heart attacks and heart disease used to be something which would affect the elderly, say beyond the ages of 60. And it was rare to see anything less than 50 to have a heart attack. Now, 25% of our patients who have heart attacks are less than age 40. And that's a big increase over the last 15 years. We also need to understand that age, at the average age in which heart attack is occurring in India, is 10 years to 15 years lower than the West. In fact, in India, heart disease has increased by 300% over the last 30 years in general, while in the West, deaths from heart attacks are decreasing. We as Indians are 3 times more predisposed to the West Caucasians, 5-6 times more prone than Chinese and 20 times more than Japanese to actually have heart attacks and heart disease. But the concern absolutely clearly is the fact that it is increasing in the younger age group, and there are specific reasons for it. And because you actually said that 50% of our population is youth, it's so important to be able to know the causes, to prevent it. And it is a concern that as heart disease goes also on with age, what would happen in 10 to 15 to 20 years' time to this very youth who's predisposed to heart disease at this stage, which is premature heart disease.